Let's continue our discussion on the lung, one of the Zhang organs. The systemic relationship of the lung. First, the lung is related to the skin and body constituent and shines in body hair. The skin and fine hair are on the surface of the human body. They rely on the lung's dispersion of qi and nourishment of body fluids. They are the first barrier against external pathogens. Through the lung qi's dispersing function, the essence can be transported to nourish and warm the skin and fine hair. When functions of the lung are normal, the skin and fine hair are lustrous. The exogenous pathogenic factors are not able to invade the body. When functions of the lung are abnormal, lung qi is deficient and fails to diffuse defensive qi onto the skin and fine hair, resulting in polyhydrosis and common cold. When skin and fine hair are affected by exogenous pathogenic factors, there will be cough or asthma due to disorder of the lung. Next relationship, the lung opens into the nose. The nose is the passageway for entrance and exit of respiration. It communicates with the lung. Therefore, the nose is the orifice of the lung. Lung has a close relationship with the nose. The normality of the nose in ventilation and smelling depends upon the function of the lung qi. When lung qi diffuses smoothly, the nose will be free from obstruction with clean smelling. If the lung qi fails in diffusion, it will lead to nasal obstruction, hyposmia, and the disease of lung are mostly caused by exogenous pathogens through mouth or nose. The next relationship, the lung corresponds to sorrow and worry and emotion. Sorrow and worry are parallel in 7 emotions. Due to the similarities between them, they are put together in 5 spirits. Excessive sorrow and worry are extremely harmful to health. In TCM, it is called qi consumption by overly sorrow and worry. When the lung qi is deficient, the tolerance of pessimistic stimulation by human body will decrease and will result in the mood swings and sadness. The deficiency of lung qi and sadness affects each other. It is easy to create this vicious cycle. Next relationship, discharge is the fluid of the lung. Snivel is the nasal discharge which nourishes the nose. When the essential qi in the lung is sufficient, the snivel moistens the nasal cavity and does not flow outward. If the lung is invaded by exogenous pathogens, it will affect the nasal secretion and discharge. It can cause the cleared nasal discharge due to the cold pathogens, as well as the yellow nasal discharge due to the heat pathogen. It will also cause dry nose due to dry pathogens. Thank you for your attention.
Interviewing. Dizziness. Dizziness encompasses everything from a slight dizziness when getting up, with dots in front of the eyes that quickly disappear again, to extreme vertigo, where the room spins around and there is difficulty maintaining balance. The main differentiation of dizziness is between shu and shi conditions, whether there is enough qi, shu or jing to nourish the brain, or something is blocking their movement up to the brain. Inquiry should be made about what triggers the dizziness. The dizziness comes when getting up. It is often due to shi chu and or shui chu, because qi and shui are not strong enough to ascend as quickly as a person getting up. In some situations, this can be due to phlegm blocking the ascent of qi and shui. Shui shu dizziness is often exacerbated during and after menstruation. This is because the woman is more shui shu due to bleeding. This type of dizziness is also common after childbirth. Shu types of dizziness are also worse when the person is tired after exertion and improve when the person has rested. If the dizziness comes when the person is stressed, frustrated, or irritated, it will be due to liver imbalances such as liver wind, liver fire, or liver yang rising. Liver fire will also manifest with a hot sensation in the head during an attack of dizziness. If the dizziness is worse after sexual activity, it will be an indication that kidney qing is not nourishing the brain. A sensation that the room is spinning round and it indicates wind phlegm. Sensations of nausea and headedness will also indicate phlegm. Dizziness is a visual distortion with a whirling sensation in the head. In mild cases, the patient will feel better after they close their eyes. In severe cases, the patient may feel as if she's riding in a vehicle or boat. The dizziness may even upset one's sense of balance or be accompanied by nausea, vomiting, sweating, or fainting. Many diseases in biomedicine, such as oral dizziness, cerebral dizziness, hypertension, hypotension, anemia, and neurosis with dizziness are their main symptoms, can be diagnosed and treated as dizziness. Definition: the general name for dizziness and vertigo. Dizziness refers to dim eyesight or blackened and blurred vision or spots in the visual field. These may only occur upon moving and last just a few seconds. Vertigo, on the other hand, is an inability to stand firmly because one's surroundings seem to be revolving. Vertigo and dizziness often appear simultaneously, in which case we simply call it dizziness. Etiology and pathomechanisms of dizziness. The two major causes of dizziness are a disturbance of the clear orifices brought on by the pathogenic factors or a lack of nourishment to the clear orifice. Dizziness is closely related to wind fire, phlegm, blood stasis, and deficiency. The clear orifice refers to the sensory orifice of the head and includes all 7 orifices as well as the brain. Pathogenic wind and fire tend to rise upward. When they attack the head, they disturb the clear orifice, which can lead to dizziness. Wind and heat can arise from either an exterior invasion or from a dysfunction of the Zangfu organs, especially the liver, because it is the organ related to wind. Ancient medical books say that all wind, shaking, and dizziness pertain to the liver. The divine pivot. This says that the deficiency of the brain leads to dizziness. Deficiency of the brain can be caused by a lack of nourishment due to qi, blood, or essence deficiency, or it may be due to pathogenic factors such as blood stasis or phlegm obstructing the channels and collaterals. In either case, the qi and blood cannot adequately circulate, and leading this to a lack of nourishment in the head. Ancient medical books say that without phlegm, there's no dizziness. Thus, phlegm is another major cause of dizziness. Dizziness and vertigo. Observation is dizziness when getting up. Significance is sishu, sway shu, or phlegm. If there's acute dizziness, especially dizziness when lying down or sitting, there's wind phlegm. Dizziness accompanied by nausea or a heavy sensation in the head means there's phlegm. Dizziness and blurred vision, which is aggravated by exertion and when tired, means qi shu, and shui shu. Dizziness that is worse after sexual activity means kidney jing shu. Dizziness and ringing in the ears, kidney jing shu. Dizziness with loud sound in the ear or headache, liver yang rising. Vertigo with heaviness in the body or head means phlegm. Signs and symptoms of dizziness with descending pain in the head. There is paroxysmal dizziness and rotary vertigo, heaviness of the head, aggravated by notion, difficulty in thinking or concentration, especially in the morning, stifling sensation in the chest, nausea and profuse sputum. If there's dizziness and vertigo that feels like motion sickness, tinnitus, red face, irritability, distending head, symptoms aggravated by emotional stress, and dizziness after head injury accompanied by sharp pain, then the indication is an excess There's wind phlegm or phlegm heat, liver yang rising or liver fire blazing upward, blood stasis. Now, for chronic hollow and heavy sensation in the head, symptoms are dizziness with desire to lie down, worse in a standing position induced by exertion, dizziness which is worse when standing up from a sitting or laying position, blurred vision, persisting dizziness and vertigo with empty feeling in the head, worse in the afternoon and evening, aggravated by overwork or overthinking. There is a deficiency. There's chi deficiency. The second is heat and spleen blood deficiency. The third is kidney essence deficiency. Thank you for your attention.
Now let's discuss diagnosis according to Xie or blood stagnation. Blood should flow freely and unhindered throughout the body. Blood can stagnate for a variety of reasons. Blood and Qi have an extremely close relationship, with blood being dependent on Qi for its movement. This means that Qi stagnation can result directly in blood stagnation. Qi deficiency can also be a cause of blood stagnation when Qi lacks the strength to circulate and spread blood. In this way, blood deficiency can also be the cause of blood stagnation. The movement of blood can also be blocked by phlegm and by physical traumas, including surgery, because when there's physical trauma or surgery, blood will leave the vessels and will no longer be circulated by qi and will therefore stagnate. Heat can condense blood so that it becomes sticky and clots. Cold can freeze and congeal blood. Just as phlegm and dampness have none of the moistening or lubricating qualities that Jinya has, blood stagnation has none of the moistening and nourishing qualities that physiological blood has. In fact, stagnant blood blocks the passage of qi and blood in the coolie and thereby prevents fresh, nutritious blood from circulating to or through an area. This means that some of the symptoms and signs of blood stagnation and blood deficiency can be very similar. There is, though, a significant difference between them, which is that the signs of blood deficiency will be limited to a very localized area and will not be systemic, as is the case when there is blood stagnation. In China, many doctors focus on treating blood stagnation in elderly patients. This is because blood stagnation is part of the aging process, and blood stagnation is often a consequence of most chronic imbalances. The consequences of blood stagnation can often be observed in elderly patients. Their movements can be stiff and painful, and they often have visible signs of blood stagnation in the form of spider navy and visible purple capillaries in the skin. Like phlegm, blood stagnation is something that is very common, but many people overlook it when they diagnose. This is because, like phlegm, the symptoms and signs that are described in Chinese textbooks are slightly oversimplified and gross. In reality, a diagnosis of blood stagnation will be based on many small signs and symptoms that are less tangible and thus more difficult to spot unless you consciously search for them. One of the main symptoms that Chinese textbooks define as being characteristics of blood stagnation is pain that is stabbing, sharp, or piercing in character. The pain will be fixed, localized to a specific place, and will not move about. The pain has this character because blood stagnation creates a physical blockage that prevents the movement of qi, blood, and jinye. This results in qi accumulating in a small and limited area where it cannot circulate. Where there is stagnation, there is pain. The pain in blood stagnation is unlike qi stagnation pain. Qi stagnation pain is more fluctuating and less fixed. When there's qi stagnation, there will be stagnation in a much larger area, but qi will be able to move about within this area. It means that the pain is more undulating and spasmodic. The pain will also be able to move slightly from place to place. Qi stagnation will also manifest with a more tense or distended sensation. Blood stagnation can manifest as physical accumulations, lumps, or hard knots in the muscle or tissue. This is because there is a stagnation of physical substance. Fibroids and myoma are examples of blood stagnation, but it is important to remember that phlegm can also create lumps in the tissue. This is because phlegm is also a physical substance. The difference between lumps and accumulations that are manifestations of blood stagnation and phlegm is that blood stagnation accumulations will be harder and have more clearly defined but rougher edges. Phlegm accumulations are less clearly defined and smoother. Furthermore, blood accumulations will be more painful. The menstrual cycle is totally dependent on blood flowing freely and unhindered. Blood stagnation will therefore often manifest with a disruption of the menstrual cycle. The cycle may be longer because blood does not flow freely and thereby stagnates in Chiang Mai. There will be dysmenorrhea and the menstrual blood will be dark and clotted. There can also be heavy or extended bleeding, with the bleeding continuing for longer than the normal for 4 to 6 days. Blood stagnation can be a factor in bleeding anywhere in the body because stagnated blood will create a blockage in a vessel. This will lead to an increase of pressure in the vessel because blood and chi cannot get past the blockage. Eventually, the pressure becomes so great that the wall of the vessel ruptures. And when there is bleeding, whatever the cause, it will itself become a further source of a blood stagnation. Because when blood exits the vessels and channels, it is no longer circulated and governed by heart chi. It will then stagnate and further disrupt the movement of chi, blood, and jinye. Thank you for your attention.
We continue with diagnosis according to 4 levels. We are now on dry heat at the way level. This pattern has traditionally been prevalent in the autumn in China when the climate is extremely dry. In northwestern Europe, this pattern can arise due to living or working in buildings with a very dry indoor climate. An invasion of dry heat can disrupt not only the functioning of Wei Qi, but also the lung, because the lung is easily damaged by dryness. The disruption of Wei Qi can be seen in an aversion to wind and cold because the Wei Qi is no longer able to protect the body against them. There may be a slight sweat due to the heat aspect. The presence of heat and the struggle between pathogenic Qi and Cheng Qi will result in a slight fever or fever sensation. The disruption of the lungs descending and spreading function can result in coughing and possibly chest pain due to stagnation of Qi. The heat will evaporate fluids in the body so that rubbery yellowish sputum is formed. The dryness and heat will injure fluids and lead to the dryness of the nose and throat. The person will be thirsty and the tongue dry. Etiology, exposure to dry heat pathogenic factor. Symptoms and signs, dry nose and throat, fever, slight aversion to cold and wind, light sweat, cough with sticky or rubbery sputum. The cough can cause chest pain, headache, thirst, dry tongue coating, rapid and superficial pulse. Key symptoms for dry heat, way level, dry nose and throat, fever with aversion to wind and cold, rapid and superficial pulse. Treatment principle, expel wind heat, activate Wei Qi. And we can choose from 214, Li4, Li11, lung 9, lung 10, UB12, UB13, kidney 6, and spleen 6. Needle technique is draining or sedation. 214 and Li11 drain heat and activate Wei Qi. Li4, UB12, and UB13 activate Wei Qi and expel exogenous pathogenic Qi. Li11 expels exogenous pathogenic Qi and drains heat. Kidney 6, spleen 6, and lung 9 moisten the lung. The person should avoid places where the air is very dry. Invasion of dry heat may be caused by no pattern. So there is no previous pattern because this occurs at the Wei level. An invasion of dry heat can result in Qi level heat, Yin level heat, and lung yin deficiency. Thank you for listening.
Let's proceed to combining points principles with the principle balancing left and right. The balancing of points on the left and right sides of the body is something that should be kept in mind when formulating a balanced point combination. There are 2 aspects to the question of balancing right and left sides when needling. The first is balancing the point combination in terms of left-right when treating a unilateral joint or channel problem. The second is the deliberate use of unilateral points to achieve specific effects. Balancing left and right when treating a unilateral problem. When treating a unilateral joint or channel problem, example, a unilateral neck ache or a unilateral elbow pain, with several points on the affected side, attention should be paid to balance left and right by adding 1 or 2 points on the opposite side. One can combine this approach with that of balancing yin and yang. For example, if you are treating a chronic left shoulder pain along the large intestine channel, we might use Li15, Li11, and Li4, all on the left. One way of balancing left and right might be to needle lung 7 on the right side. This would achieve the effect of balancing left and right and also yin and yang. In some cases, we can balance left and right, yin and yang, and upper and lower. The same example of left shoulder pain using Li15, Li11, and Li4 all on the left, we might balance this with points on the left with liver 3 on the right. This achieves a balance of left and right, yin and yang, in upper and lower. Of course, one would not needle liver 3 simply to balance the points on the left, but it would be particularly indicated if the patient suffered from a liver disharmony. Now let's go to unilateral needling. Generally speaking, in the majority of cases, bilateral needling is the rule. Such a technique is adopted when a strong effect is needed. However, there are cases when unilateral needling is just as effective. Points can be needled unilaterally in order to balance the left and right sides. This technique obtains the same therapeutic effect using fewer needles, which is always a bonus, especially for nervous patients, those who are being treated for the first time, or those who have a severe deficiency of Qi and blood. Even in other normal cases, reducing the number of needles used to minimum without compromising the therapeutic effect is a desirable goal. Unilateral needling, balancing a point on the left with another on the right side, can sometimes give even better results than bilateral needling. In particular, if the points balanced between left and right are also at the opposite ends, that is, one on the arm and the other on the leg, the effect is particularly dynamic. It is as if a pressure was applied along the tangent of a circle at the opposite ends, making it spin, as shown in the diagram on the right. So unilateral needling is usually used to move qi and blood, and bilateral needling to tonify qi and nourish blood or yin. Again, unilateral or crossover needling is usually used to move qi and blood, and bilateral needling to tonify qi and nourish blood and yin. Thank you for your attention.
Diagnosis according to Zhang Fu organ patterns, stomach qi shu. Stomach qi shu. This pattern is very similar to spleen qi shu, both in its symptoms and its etiology. In fact, the two patterns often overlap and are commonly diagnosed together in clinical practice. Etiology: eating too much at a time, eating too little, eating too often, eating whilst working, or when stressed, or eating irregularly are all factors that can weaken stomach qi. Stomach qi will be debilitated by prolonged overwork and stress. Chronic illness will particularly enfeeble both stomach and spleen qi. Symptoms and signs would be fatigue, discomfort in the abdominal area, loose stools, bloating after meals, fatigue after meals, pale face, poor sense of taste, poor appetite or no appetite in the morning, weak limbs or tiredness of the limbs, craving for the sweet flavor, tendency to gain weight, disinclination to speak, and the voice lacks strength. The person looks tired and emanates weariness, slump posture, worries a lot or constantly speculates about things, pale, swollen tongue, possibly with teeth marks on the side, weak pulse, especially in the right one position. Key symptoms: fatigue, loose stools, pale tongue with teeth marked, and a weak guan pulse. Treatment principle: tonify stomach qi. Acupuncture points you may choose from: stomach 36, spleen 3, spleen 6, rent 12, UB20, and UB21. The needling technique should be a tonifying, or moxa can be used. Explanation: stomach 36, spleen 3, spleen 6, rent 12, UB20, and UB21 tonify stomach qi. Relevant advice. The dietary change are alpha and omega in the treatment of stomach chi shu. It is important that the person focuses on what and particularly how they eat. They should eat enough food and not fast or go on diets where they do not consume sufficient food. At the same time, they should not eat too much at a time, as this will result in food stagnation. Constant snacking will also weaken the stomach chi. The patient should try to eat as calmly as possible. This means they should not eat whilst working or driving, when they are stressed or whilst they are doing something else. They should also ensure that they get enough rest and do not exert themselves after they have eaten. They should not eat too late at night. Walking around or lightly stretching the front of the body after eating will support the chi mechanism in the middle jiao and thereby support the stomach chi. The person will benefit from eating porridge in the morning, soups, mashed or pureed vegetables, stews, steamed or boiled vegetables. Example, easily digestible foods. The use of aromatic herbs in the diet will help to circulate qi and thereby help to prevent food stagnation. It is important that the person does not sit still for extended periods of time and they do not sit in a slump posture. Walking or stretching after meals is recommended. Physical exercise in general will be beneficial. Stroking downwards with the fingers from Ren 16 to Ren 8 will help support qi to descend. Stomach chi shu can be caused by the following pattern of imbalance. Spleen chi shu. Spleen chi shu can result in the following patterns of imbalance. Spleen chi shu, stomach yin shu, spleen yang shu, food stagnation, damp, phlegm, shui stagnation. Stomach chi deficiency. Etiology, diet lacking in nutrients. Example, proteins, excessive dieting, or chronic illnesses. The underlying and accompanying pathology are spleen chi deficiency. Signs and symptoms would be epigastric discomfort, which is better after food or with pressure. Poor appetite, preference for warm foods and drinks. No thirst, vomiting of clear fluid, cold and weak limbs, tiredness, pale complexion. The pulse would be empty, especially right middle position. The tongue would be pale. Treatment principle is to fortify the center and warm the stomach. Acupuncture treatments. Stomach 36, bladder 21, pericardium 6, Ren 4, stomach 21, Ren 12, Ren 6, and bladder 20. Thank you for your attention.
Let's go to the topic, diagnosis according to Qi, Shui, and Jinyi imbalances. Shui stagnation. Blood should flow freely and unhindered throughout the body. Blood can stagnate for a variety of reasons. Blood and Qi have an extremely close relationship, with blood being dependent on Qi for its movement. This means that Qi stagnation can directly result in blood stagnation. Qi deficiency can also be a cause of blood stagnation when Qi lacks the strength to circulate and spread blood. Blood deficiency can, in this way, also be the cause of blood stagnation. The movement of blood can also be blocked by phlegm and by physical traumas, including surgery, because when there is a physical trauma or surgery, blood will leave the vessels and no longer be circulated by Qi and will therefore stagnate. Heat can coagulate blood so that it becomes sticky and clots. Cold can freeze and congeal blood. Just as phlegm and dampness have none of the moistening or lubricating qualities that Jinyi has, blood stagnation has none of the moistening and nourishing qualities that physiologically blood has. In fact, stagnant blood blocks the passage of Qi and blood in the culi and thereby prevents fresh, nutritious blood from circulating to or through an area. Therefore, some of the symptoms and signs of blood stagnation and blood deficiency can be very similar. There is, though, a significant difference between them, which is that the signs of blood deficiency will be limited to a very localized area and will not be systemic, unlike in blood stagnation. The treatment of blood stagnation is often relevant in elderly patients. This is because blood stagnation is part of the aging process, and blood stagnation is often a consequence of most chronic imbalances. The consequence of blood stagnation can often easily be observed in elderly patients. Their movements can be stiff and painful, and they often have visible signs of blood stagnation in the form of spider navy and visible purple capillaries in the skin. As we saw with phlegm, blood stagnation is very common but is often overlooked in diagnosis. This is because, like phlegm, the symptoms and signs that are described in Chinese textbooks are crude and slightly oversimplified. In reality, a diagnosis of blood stagnation will be based on many small signs and symptoms that are less tangible and thus more difficult to spot unless you consciously search for them. One of the main symptoms that Chinese textbooks defines as being characteristics of blood stagnation is pain that is stabbing, sharp, or piercing in character. The pain will be fixed and localized in a specific place and will not move about. The pain has this character because blood stagnation creates a physical blockage preventing the movement of qi, blood, and jianye. This results in qi accumulating in a small and limited area because it cannot circulate here. Where there is stagnation, there is pain. The pain in blood stagnation is unlike qi stagnation pain. Qi stagnation pain is more fluctuating and less fixed. When there is qi stagnation, there will be stagnation in a much larger area, but qi will move about within this area. It will mean that the pain is more undulating and spasmodic. The pain will also be able to move slightly from place to place, and qi stagnation will manifest with a tense or distended sensation. Blood stagnation can manifest as physical accumulations, lumps, or hard knots in the muscle or tissue. This is because there is a stagnation of a physical substance. Fibroids and myoma are examples of blood stagnation, but it is important to remember that phlegm can also create lumps in the tissue. This is because phlegm is also a physical substance. The difference between lumps and accumulations that are manifestations of blood stagnation and phlegm is that blood stagnation accumulations will be harder and have more clearly defined but rougher edges. Phlegm accumulations are less clearly defined and are smoother. Furthermore, blood accumulations will be more painful. The menstrual cycle is dependent on blood flowing freely and unhindered. Blood stagnation will therefore often manifest with a disruption of the menstrual cycle. The cycle may be longer because blood does not flow freely and thereby stagnates in Chiang Mai. There can be dysmenorrhea and the menstrual blood can be dark and clotted. There can also be a heavy or extended bleeding, with the bleeding continuing for longer than normal 4 to 6 days. Blood stagnation can be a factor in bleeding anywhere in the body. This is because stagnated blood will create a blockage in a vessel. This will lead to an increase of pressure in the vessel because blood and qi cannot get past the blockage. Eventually, the pressure becomes so great that the wall of the vessel ruptures. When there is bleeding, whatever the cause, the bleeding will itself become a further source of a blood stagnation, because when blood exits the vessels and channels, it will no longer be circulated and governed by heart qi. It will then stagnate and further disrupt the movement of qi, blood, and jianye. The heart has a function of governing blood and can easily be affected by blood stagnation. This will manifest as a sharp pain in the chest and disturbance of the cardiac rhythm. Stagnated blood does not have any of the nourishing qualities of blood. On the contrary, blood stagnation blocks fresh, nutritious blood from circulating through an area. This can result in the skin above an area where there is stagnated blood being dry, flaking, or thickened. There may also be changes in skin pigmentation. By blocking the circulation of blood in area, blood stagnation will prevent Shen, which is anchored by and thereby circulates together with blood from flowing through the area. This can result in a sensation of numbness. This is typically seen when there is a scar tissue. The stagnated blood from the trauma or the operation will have accumulated in tissue around the operation site or the injured area. The tissue is often hard and thickened, and there is either numbness or sensory disturbance in the area, all of which are characteristics of blood stagnation. Stagnated blood moves more slowly, if at all, and is therefore less oxygenated. This can be seen in generalized signs such as a dark facial complexion, dark lips, dark or purple nails, purple tongue, and swollen veins on the underside of the tongue. Wherever there's tissue, skin, or blood vessels that are purple in color, this will be a sign of blood stagnation. Typical examples of this are bruising, varicose veins, and spider navy. The pulse can be choppy, wiry, or confined when there is blood stagnation. It can also be knotted if there is heart blood stagnation. On the mental emotional level, blood stagnation can impede the movement of Shen. This may mean that the person is psychotic or depressed, or that they may have difficulty staying awake. A way of testing whether someone has blood stagnation is to fold their ear and squeeze it tightly together with your fingers. The more stagnation of blood there is, the more painful it will be. You can also press your fingers into the skin in area where you suspect that there may be blood stagnation and then release them again. The more stagnation there is, the longer it will take before the white imprint of the fingers and the color of the skin fades away. Thank you for your attention.
For depression, we will discuss two case histories. Case history 4 and 5. A 51-year-old woman had been suffering from depression for 3 years. This had coincided with the onset of menopause. She felt very low, dissatisfied with life, and sad, and was prone to crying. She also felt vulnerable and burst into tears at the slightest negative comment that a member of her family might make. She also lacked drive and enthusiasm. On interrogation, it transpired that she suffered from lower backache and frequent urination. She always felt cold. Occasionally, she experienced some phlegm in the throat that she needed to expectorate. Pulse was wiry and slippery and weak on both rear positions. Her tongue was pale, swollen with teeth marks, and had a sticky coating. The wiry pulse indicates that there was liver qi stagnation, and this restrains the coming and going of the ethereal soul, leading to depression. The weak pulse on both rear positions, backache, and frequent urination indicate a kidney deficiency, which accounts for the lack of drive and enthusiasm. There is also some phlegm, as evidenced by the slippery quality of the pulse, the swelling of the tongue, and the occasional expectoration of phlegm. The phlegm also restrains the coming and going of the ethereal soul, contributing to the feeling of depression. The next case history is that of a 48-year-old woman who had been suffering from depression for 12 years. Besides feeling depressed, low, and sad, she also felt anxious and slept badly. As she described it, her mind was in constant turmoil. She also experienced a feeling of oppression of the chest and palpitations. Her tongue was slightly red on the sides and swollen, with a stomach-heart crack and a sticky coating. Pulse was slippery, weak on both rear positions, and slightly overflowing on both front positions. The tongue and pulse are absolutely crucial to diagnose this case. The redness of the tongue indicates heat, while the swelling and sticky coating indicate phlegm. This was confirmed by the feeling of oppression of the chest. The stomach-heart crack is a midline crack that is long and narrow, like a heart crack, but also broader in the center. In the stomach area, the swelling, redness, and the crack all indicate the presence of phlegm heat in the heart and lungs. This is confirmed by the slightly overflowing quality on both front positions, heart and lungs, of the pulse. Such an overflowing quality is often related to emotional stress affecting those two organs. Finally, the weakness of the pulse on both rear positions indicates that there is also a kidney deficiency. Thank you so much for listening.